Hi everybody, I'm Logan Jacobs. I'm a second year DO student here at ATSU-KCOM, as well as a student ambassador. I attended the University of Wisconsin-Madison, where I majored in kinesiology and biology. But today is not about me. I have Dr. Billy Strait with me today. He is a 1991 graduate of ATSU-KCOM and one of our OMM faculty members. So how are you today, Dr. Strait?
I'm doing great, Logan. Thank you very much for inviting me to do this.
Thank you for meeting with us today. So in a previous Spotlight interview done by Justin Hicklin, he interviewed Dean Wilson, and they kind of talked about what makes ATSU so special. So if you haven't seen that Spotlight interview, I encourage you to go give it a watch at www.atsu.edu/news. For today, however, I wanted to focus more so on the osteopathic heritage of ATSU, because ATSU-KCOM is the founding institution of osteopathic medicine. So today we'll talk about kind of what OMM is and highlight the versatility in treatment that we can use OMM for to help treat our patients. And for that, I have Dr. Strait with us. So I will get started with some questions that hopefully Dr. Strait can answer and kind of lead us in the right direction. So Dr. Strait, to begin, can you give us a brief description of what OMM is and tell us kind of your background with OMM and why you wanted to go in and practice OMM?
Yeah, Logan, thank you again, and hi, everybody. I'll try to, obviously some of the stuff could be really in depth. I'll try to be brief and concise as possible. Logan's mentioned the initials OMM, that stands for Osteopathic Manipulative Medicine. And that's a tool that osteopathic physicians have to use to diagnose and treat not only musculoskeletal conditions on the patient's body, such as back pain, neck pain, or headaches, but also to help with any visceral problems that the patient may be having, such as heart disease or stomach ulcers or bowel problems, anything like that. We can use our hands to help diagnose and treat those kind of conditions as well. I'm really interested and attracted to that because I was raised in a pretty rural place and didn't have too much connection with anything outside of the immediate family. And so we kind of took care of ourselves, and I got really interested and my parents got really interested in nutrition and health and taking care of ourselves. And I like that approach of thinking about things. And I also like using my hands always as well, growing up, woodwork, that kind of thing. And I always like biology type classes, and learning about the body is just amazing how the body works. So that combination of things led me to looking into medicine. And then specifically, I found about osteopathic medicine and being an osteopathic physician and being able to use hands-on thought process to help a patient, and without near as many side effects as other treatments can give to a patient. And I'll use medications, for instance. Every medication you take can have a side effect, and using my hands without making a patient take something, just using my hands to help the patient made sense to me. And it's been really good, had good results taking care of patients. They seem to like the hands-on touch from a physician. There's hardly any side effects from it, and get good results and improvement in these patients' conditions as well. So I think that kind of answers some of those questions. Logan, is that pretty good?
No, that was really thorough. That was a good answer.
Good.
I think a lot of people come to ATSU and KCOM for that holistic healthcare. That's a really good point.
I agree.
So you're also a course director for semesters 1 and 2. Can you describe your role as a course director and maybe what your favorite part of teaching is here?
Yeah. I of course I've been teaching 30 years or so, and just kind of continue to go from one position to another. Right now, being the course director for the first and second semesters is kind of where I'm at. And what that means is I kind of get together the schedule for the students in semester 1 and semester 2 with the material that we want to teach, get those professors, including myself, involved in teaching those different lectures and labs. And we have both of those things. Most of the time, these things are combined and taught in our lab where we teach osteopathic manipulative medicine. we'll talk a little bit, and then to let the students diagnose and treat each other in lab, pair up and do that, which is really a unique experience in itself. And that day one in osteopathic medicine, you get your hands on a patient, and I'll put patient in quotes, but you know what I mean. As a different body, you may not be used to palpating or touching somebody else, and this is a good way to kind of get started in that training of being a physician. So I put that together to help teach the students in that first and second semester to get used to it. I like what I do mainly because of this following reason. I, as a physician, I could be seeing more patients myself through the day if I didn't take the time to teach in the mornings. Usually I teach in the mornings and see patients in the clinic in the afternoons and do consults in the hospital when I get a chance between those things. I could see more patients myself if I didn't teach. However, that's a certain number of patients I can see. When I can teach, say 172 students to do what I'm doing, what I can do to take care of that many more patients that they'll eventually take care of, I really have helped that many more patients than just the ones I can treat myself. So helping patients is what it's all about as far as I'm concerned, and I've been able to reach out to that many more patients and help them by helping teach students to do that as well. So that's what I enjoy about the teaching aspect of it, Logan.
Yeah, well, we enjoy having you as a professor too, so
Thank you.
both ways.
Appreciate that.
And then, so another question we have for you. So there's a specialty called PM&R, which is physical medicine and rehabilitation. And that's, it uses a lot of osteopathic manipulations, really hands-on. That's what I understand. And a lot of, I won't say a lot of students, but there's for students and medical students who aren't going into PM&R, how can they use OMM to help treat their patients if they go into a different specialty?
Right. I kind of mentioned that a little bit about the kind of the hands-on approach that we as osteopathic physicians have. And if you go to any medical school of any kind, you'll notice that there's always need for the physician to be palpating a patient to diagnose something wrong. Say somebody has a stomach pain or issue, then the physician, like a surgeon, will come in and actually palpate the stomach to find out where the problem is. And so there's a need for good hands-on feeling with the fingers. And as osteopathic physicians, we get even more training in that so that you have even more skills of feeling things with your fingers to help diagnose and make a diagnosis for a patient. So any practice as a physician of any kind, if you touch patients at all, and most do and should, would be a benefit to be able to use that hands-on palpation skills that you can learn. Also, there are, I mentioned conditions that you can use to help diagnose and treat by using your hands, such as heart conditions and stomach upset and bowel problems, that kind of thing. So even a family practice physician sees all that kind of stuff, and there's ways that we can use our hands to diagnose and treat those kind of things, and help make a better diagnosis, help make a better treatment. Then that's going to be beneficial for any doctor to be able to help any patient that they see.
I can attest to that too. From day one coming into the OMM lab and working on my partner, there's definitely a big difference. It's a skill that you have to practice, and you don't appreciate it until you get in there and start working with your hands.
There sure is, yeah. And again, I think it's a big benefit of the osteopathic profession, having hands-on approach almost day one as a first-year medical student, instead of waiting until you actually go on rotations in your third year to actually start seeing a real patient, to touch them, to do a physical exam, which is the basic knowledge that a student and a doctor needs. You get it earlier, much earlier in osteopathic medicine training.
And last but not least, this question's geared more towards Kirksville. So when you're not teaching or working in the clinic, what do you like to do around Kirksville? What are your favorite things?
Okay, kind of a hobbies and interest direction there, it sounds like. First off, I do like Bible study. I try to do that as much as I can, and church involvement where I'm at. I like to stay in shape. I mentioned I like kind of a natural approach to things, and nutrition and preventive medicine, which is a big interest of mine. Keeping from getting sick in the first place is more important to me than getting sick and having a doctor try to take care of you. Is actually teach patients how to take care of themselves ahead of time. So I try to do that as well. So I like to jog, I lift weights, that kind of thing. I also was raised in the country, so I enjoy things in the country, and Kirksville has a lot of that to offer. Like to fish, like to do some hunting, shooting, that kind of stuff. So that really goes hand in hand with being in the Kirksville area if you like that kind of thing. There's plenty of country to do that in. Obviously doing things with my daughter is important as well. And so do things with family and those kind of relationships too. That's the main thing I can think about. I probably missed something. There are other interests, but those are the ones that come to mind for sure.
Awesome. Yeah, I definitely enjoy getting out there too and going to Thousand Hills. It's a nice lake you can go swimming and boating in.
Yep. Yep. Hiking's good. Like to do some hiking, a lot of trails around Thousand Hills. Lake. Yeah.
All right. Well, those are all the questions I have for you today, Dr. Strait.
Okay.
Thank you for taking the time to meet with us. I know we all appreciate it.
Thank you.
What was
that?
Thank
you, Logan. Thank you, Logan. I appreciate the opportunity to do this, and I hope I helped out and help people make some decisions on what they want to do with their careers in life.
So if anybody else has any other questions, feel free to reach out to admissions. I know there's a lot of student ambassadors like myself that would be happy to answer them, as well as I'm sure Dr. Strait would be able to answer questions too. So
sure would.
Thank you again, Dr. Strait, and thank you for your time.
Thank you. Have a great day.